Welcome to House of Thought Therapy, where we delve into the transformative world of psychology and therapy. Today, we're focusing on cognitive behavioral therapy, commonly known as CBT, a highly effective treatment approach that addresses dysfunctional emotions, behaviors, and cognitions through a goal-oriented, systematic procedure. If you're seeking to understand how CBT works and how it might benefit you or someone you know, you're in the right place. What is CBT? Cognitive behavioral therapy is grounded in the belief that our thoughts and perceptions influence our behavior. Emerging in a wave of revolution within the psychological community, CBT was developed through the pioneering work of Dr. Aaron T. Beck in the 1960s. It's based on the concept that our thoughts about a situation affect how we feel emotionally and physically, which in turn affects how we act. In essence, CBT helps individuals recognize negative thought patterns and offers strategies to challenge and overcome them. The CBT process. The process of CBT is both collaborative and structured. Therapists and clients work together to identify and understand problems in terms of the relationship between thoughts, feelings, and behavior. The approach involves identifying specific problems and setting personal goals. With guidance, clients learn to identify distorted thinking, modify beliefs, relate to others in different ways, and change behaviors. A key element of CBT is homework or practice outside of therapy sessions, as CBT is an active intervention that encourages clients to practice the skills learned. Effectiveness of CBT. The effectiveness of CBT has been extensively researched. It's been found to be as effective as or more effective than other forms of psychological therapy or psychiatric medications. It is particularly potent in treating anxiety disorders, depression, eating disorders, and post-traumatic stress disorder. However, it's not a one-size-fits-all solution and may not be effective for everyone. The success of CBT depends on the individual's commitment to the process and the skill of the therapist. CBT Techniques. CBT employs a variety of techniques. One of the primary methods is cognitive restructuring, which involves challenging and changing unhelpful thoughts. Another technique is exposure therapy, particularly effective for phobias and obsessive-compulsive disorder, where clients are gradually exposed to what frightens them until the fear begins to fade. Behavioral activation, which encourages clients to engage in meaningful activities, is often used for depression. These techniques aim to bring about significant improvement in quality of life. Advantages of CBT. One of the advantages of CBT is that it tends to be shorter in duration compared to other therapy forms. It's highly instructive, and clients are often given practical homework assignments. Over time, a new strategy for dealing with problems becomes a habit, potentially leading to lasting change. Moreover, CBT's structured nature makes it transferable across different cultures, and it has been adapted for group therapy, self-help books, and online resources. Limitations and considerations. Despite its many benefits, CBT is not without limitations. It requires active involvement and the completion of homework, which not all clients are willing or able to do. It can also be less suitable for people with complex mental health needs or learning difficulties. Critics argue that by focusing on the individual's capacity to change themselves, CBT can overlook external factors that affect mental health, such as social and economic circumstances. Conclusion. In conclusion, cognitive behavioral therapy is a versatile and well-established approach in the psychological treatment landscape. Its efficacy is backed by substantial research, and its structured, practical techniques offer tools for individuals to bring about change in their thought patterns and behaviors. While it may not be the universal remedy for all psychological issues, its contributions to mental health treatment are undeniable. For those considering therapy, CBT offers a clear, evidence-based path to addressing a variety of psychological challenges. Outro. Thank you for tuning in. If you found this overview of cognitive behavioral therapy insightful, please like, share, and subscribe for more psychological insights and explanations. Remember, mental health is a journey, and therapies like CBT are here to provide guidance and support. Until next time, take care and continue to nurture your mind. Nurturing minds, empowering lives.